Hi there, this is Mark Edelman, speech-language pathologist, and welcome, and thanks for joining me on my walk this morning. This morning, this particular video is going to be about conflicts in aphasia, or we could call it aphasia conflicts. And what is a conflict? A conflict is two ideas that you may be thinking, and they both conflict with each other. That means you have two ideas. One idea is to do X, and the other idea is to do Y. And this can cause a conflict. This can cause you to be upset. This can cause concern. This can cause tension, where you want to do something on one hand and you want to do something else on the other hand. And that is one of the biggest problems that we face in mankind today. If you've had a conflict with anybody, you know how upsetting it can be. It can be if you have a conflict with your loved one about something, that can work on you and that can fester, and it can be very upsetting. So I want to just talk about how to resolve a conflict. And there are many, many different ways. And the way I'm going to share with you may definitely work for you, or it may not. But anyway, it's just a way that some people resolve conflicts. And for right now, I'm going to talk about a conflict that you have with yourself. But the fundamentals of this conflict resolution can also work when you have two people who both want something. One wants one thing and the other wants the other. And that can definitely set up a challenge between two people. No question about it. So the first thing you have to do, I think, if let's say you have a conflict about something, is to write it down. So write down what exactly the conflict is. All right? So, there's lots of examples. I'm going to give you an example, okay? So I've had the conflict for the last couple of months. And one part of me wants to dedicate myself to doing photography and doing more of it. And the other part of me says, look, you love speech pathology, you love helping people, you love writing about how to correct speech problems, and you get a great deal of satisfaction of working with patients with aphasia and teaching a caregiver how to stimulate speech. You love both of them. So the first thing you got to do is you got to write down what the conflict is. And in my case, one part of me wanted to spend more time on photography, and the other part of me wanted me not to change anything about what I'm doing with speech pathology because I like it so much and it's part of my identity. And not only is it part of my identity, but it's also part of my purpose. Okay, so whatever the conflict is, you got to write it down. And so if one part of you wants to do one thing and the other part of you wants to do the other thing, then what you have to do is you have to look at them like there were two people at the table. Okay? You almost have to divide yourself into two people. And so you have two parts of you. One part wants A, the other part wants B. And then here's my question that I want you to do after you write down the conflicts is, the big question is, what would prevent you from being able to do both? That's it. What prevents you from doing both? Or how could you do both? Or how could you satisfy both parts of you that want A and B? Why should you neglect one when one part of you wants a certain thing? Okay, so what you want to do is write down where you're in conflict. One part of you wants this, one part of you wants the other, and then to ask the question, what's preventing me from having both? Why not have both? Why not have it all? So that's what you want to do. You know, I had a friend of mine who told me he was in conflict yesterday, and he told me the two things that he was conflicted about. And I said, well, why don't you do both? Find a way to do both. Find a way to include both in your daily living or in whatever you're doing. Do both. Okay, and the final thing, I want to say here, and I hope you can send me a note at the bottom of this video and just tell me if you were able to resolve a conflict that way. All right, so here's another thing. When you have a conflict with somebody else, you have to make sure that you listen very, very closely. Now, my wife Malka is a wonderful, wonderful woman. And she doesn't like to drive, and she doesn't want to drive. So wherever we go, she always wants to be near a bus line so she can get on a bus and go into town, and she can be as independent as possible. Now, a lot of times, that's very, very, very difficult. And sometimes in the past, I've just gone ahead and located a park, maybe because the price was better, or maybe because the internet was better. But you know something? There'd always be a conflict, because she wants to be near something where she can get to and from. And so what I had to finally do is I had to think more about her and think more about her needs. And now, whenever we decide on a place to park our RV, whenever we're in a different state or a different city, I always make it a point to make sure that we're near some public transportation so she can get places. So that's an example of two conflicting ideas. One conflict is you want to save money. Okay, and there's nothing wrong with that. We all want to save money. And the other is, well, my wife wants to be close to so she can get to the city. She wants to be independent, so she wants to be close to public transportation. So what you have to do is you have to ask yourself, how can I do both? How can I achieve both? How can I make everybody happy? So it's in your mind, if you have a conflict, you want to make both parts of you happy. And if you're in conflict with somebody else, you want to make that person happy. It's called negotiation. You want to make that person happy, and you want to make yourself happy. So that's one of the ways you resolve conflicts. And I know people are having conflicts with treatment of aphasia. Sometimes one party wants one thing and the other party wants the other. Sometimes an individual with aphasia doesn't want to go. So you have to find out why. What's the reason? And if that's so, you want to find out what the purpose is, what the reason is. Maybe it's the therapist, maybe it's the method, but or any number of things. Or should I get individual therapy, or should I get private therapy, or should I do this or this or this or this or this? There are so many decisions that caregivers need to make, and the most important thing when you're in conflict is to jot down the parts of you that want one thing and the other part of you that wants the other thing, and then look at both and then negotiate between the two of them so that you can give both parts of you, or if you're in conflict with somebody else, make sure that you consider both sides and you do your best to satisfy both sides of the equation. This is Mark Idelman, speech-language pathologist. If you'd like some more information about aphasia, just contact us at our website at teachingoftalking.com. Or if you want to send me an email at markidelman@teachingoftalking.com. And we have a Facebook page. If you go to Facebook and you put in teachingoftalking.com, you'll see our Facebook page. Come join us. Come and become a member of the family. And if you go on our website at teachingoftalking.com, you can get on our mailing list. You can send a survey to me if you want to have a free telephone conversation with me. And so I'm here to help you. And let me know. It's been nice sharing this video with you, and hope to see you again soon. Thanks a lot now. Bye-bye. Don't forget, click underneath for the website, click underneath for the questionnaire, or make a comment. Thanks a lot. Bye-bye now.